Hi everyone, welcome to Rose Care. Today being the world's first aid day, we at Rose Care are going to show you how to conduct first aid on an unconscious patient. Our first aider today is
Pauline, and you're going to use the mnemonic Dr. ABC in the demonstration today. D standing for danger, R standing for response, then you call for help, A standing for airway, B standing for breathing, and C standing for circulation. Let us go to a demonstration. First things first, I'm going to make sure that I am safe. As you can see, I have my gloves, I'm in my mask. I'm going to make sure that I'm safe. Second, I'm going to make sure that my patient, the environment my patient is safe. Remove any item, check for any item and equipment that may cause harm to the patient. If there is no, then you are going to start and check for my patient's response. I'm going to call my patient's name. Rose, can you hear me? If she does not respond, I'm going to go next and pat her shoulder, both if possible. If she still does not respond, I'm going to inflict pain either on her ear or on her hand. If she twitches, then I'm going to immediately go to elevate my patient's legs. I will ensure that the legs are above heart level. That is very necessary. If you have a stool or a chair, you can place the legs as you continue your survey. If there is someone else who can still hold the legs, you can still do that. But if there's no, you hold. However, in a situation that the patient does not respond in either of the three ways, you will check the patient's airway. I'm going to tilt my patient's head. I'm going to check for her airway. Check any obstruction, anything that may hinder my patient from not breathing well. If there are any secretions and you have a sanction, you can use. If there is no obstruction in the patient's airway, I'm going to go next to breathing. I'm going to put my ear next to my patient's nose, listening to my patient's breath sounds. And while doing that, you're going to observe the fall and rising of the chest. If the chest is rising and falling